Hello, Brad here from 999 KnowHow. In this video, I'll be going through respiratory pathophysiology, looking at common respiratory conditions like pneumonia, bronchitis, cystic fibrosis, asthma, and emphysema. So, let's get started. Pneumonia is an infection that inflames the air sacs in one or both lungs. Symptoms include a cough, high temperature, and difficulty breathing. Causes can include bacteria, viruses, or fungi. Bronchitis occurs when the lining of the bronchial tubes become inflamed. Common symptoms include coughing up mucus, wheezing, and chest discomfort. It can be acute, often due to an infection, or chronic, usually caused by smoking or air pollution. Cystic fibrosis is a genetic condition affecting both of the lungs and digestive system. It leads to thick, sticky mucus production, which can cause blockages and frequent lung infections. Asthma is a chronic condition where the airways become inflamed and narrowed, making it hard to breathe. Symptoms include wheezing, coughing, chest tightness, and shortness of breath. Triggers can include allergens, exercise, and respiratory infections. Emphysema is a type of chronic obstructive pulmonary disease that gradually damages the lung tissue, particularly the alveoli. It results in shortness of breath and is often caused by long-term exposure to irritants such as cigarette smoke. In an emergency situation, time is of the essence. Your ability to conduct a thorough patient assessment is crucial to understanding the patient's condition and determining the next steps of treatment. Patient assessment should always follow a structured approach, starting with scene safety. Ensure the environment is safe for both you and the patient. Check for hazards such as traffic, fire, or dangerous structures. Your safety is a priority. Quickly assess the patient's condition from a distance. Look for their level of consciousness, breathing patterns, and any obvious signs of distress, like severe bleeding or unresponsiveness. Once the scene is safe, follow the C-A-B-C-D-E approach to prioritize and manage any life-threatening conditions. Remember, C is for catastrophic hemorrhage, A is for airway, B is for breathing, C is for circulation, D is for disability, and E is for exposure. After completing the primary survey, it's time to gather more detailed information using the sample and Socrates method. Using the sample history method helps us build a picture of the patient's background. S for signs and symptoms, A for allergies, M for medications, P for past medical history, L for last oral intake, and E for events leading up to the incidents. For pain assessments, use Socrates. S for sight, O for onset, C for character, R for radiation, A for associations, T for time course, E for exacerbating or relieving factors, and S for severity. Once you've completed the primary survey and gathered a focused history, it's time to perform a focused physical respiratory examination. The respiratory physical exam involves inspection, palpation, percussion, and auscultation. First, observe the patient for signs of respiratory distress. Look for the use of accessory muscles, cyanosis, and abnormal breathing patterns such as rapid, shallow breaths or laboured breathing. Feel for symmetry in the chest expansion by placing your hands on the patient's chest as they breathe. Gently tap the chest to assess density of the lung. A dull sound could suggest fluid in the lungs, while hyperresonance, which is a hollow sound, may indicate pneumothorax. Finally, listen to the lungs using a stethoscope. Abnormal breath sounds are heard as wheezing, crackles, or rhonchi. Hearing these breath sounds can help identify conditions such as asthma, pneumonia, or bronchitis. By combining these examination techniques with the primary survey and focused history, you can form a clear picture of your patient's respiratory status and determine the most appropriate treatment. Let's apply this patient assessment method approach to a patient presenting with symptoms of pneumonia. First, during your primary survey, assess airway and breathing, looking for signs of any respiratory distress, such as rapid breathing or inability to complete full sentences. The patient may require supplementary oxygen if their oxygen saturations are low. When you move into the physical examination, you notice important findings. On percussion, there's dullness over the affected lung, suggesting fluid buildup, possibly due to infection, and on auscultation, there is presence of crackles, which could indicate pneumonia. Based on these findings, you would transport the patient to definitive care for further investigations like a chest X-ray and antibiotic therapy. Next, let's apply our approach to a patient experiencing an asthma attack. This patient presents with wheezing and difficulty completing full sentences. First, as part of your primary survey, you focus on the airway and breathing. Assess the airway for any obstructions. Listening for wheezing is a key sign of airway narrowing. Check the patient's breathing pattern. Are they using accessory muscles? And are they struggling to get words out? Based on JL-Calc protocols, the next step would be to administer bronchodilators, if you are able to administer medications within your scope of practice. This is typically salbutamol via a nebulizer or inhaler. This medication helps relax the airway muscles and improve airflow. After initial treatment, reassess frequently. Keep monitoring vital signs, including respiratory rate and oxygen saturations. Be vigilant for signs of deterioration, like increasing fatigue or reduced breath sounds, which may indicate worsening respiratory function. By following the structured approach and linking it to the assessment methods, you'll be able to manage asthma attacks effectively, ensuring rapid intervention and close monitoring in line with JL-Calc protocols. Let's quickly recap the key points we've covered. Common respiratory conditions include pneumonia, bronchitis, cystic fibrosis, asthma, and emphysema. Physical examinations include inspection, palpation, percussion, and auscultation to identify any respiratory issues. Quick but thorough assessments are crucial for managing conditions such as COPD and asthma. Thanks for watching. I hope this video has provided you with an understanding of respiratory pathophysiology and the assessment methodology. If you found this content helpful, please like, subscribe and follow us to help support the channel. Have any suggestions for any future videos? Leave them in the comments below.